Have you ever had trouble falling asleep, staying asleep, or found yourself waking up too early? This is a common experience for those grappling with insomnia, a sleep disorder that disrupts the natural sleep cycle. Insomnia is not a one-size-fits-all condition. It manifests in different forms, namely acute and chronic. Picture acute insomnia as the occasional sleepless night, often triggered by stress or a significant life event. It's short-term, fleeting, and usually resolves without treatment. On the other hand, chronic insomnia is the long-term inability to achieve restful sleep, persisting for a month or more. This form of insomnia often stems from underlying health conditions or disruptions in your daily habits. It's like a stubborn guest who overstays their welcome, affecting your energy, mood, and overall quality of life. Understanding what insomnia is the first step to managing it. Now let's dive deeper into its types. Insomnia can either be a primary issue or secondary to other conditions. This means primary insomnia stands as a condition in its own right, not triggered by any underlying medical or psychiatric issues. On the other hand, secondary insomnia is a sleep disorder that occurs as a symptom or side effect of another health condition, be it physical or mental. Here, it's important to introduce the concept of comorbidities, which are multiple health issues that exist simultaneously in a person. Comorbidities play a significant role in insomnia, as they can either cause or exacerbate the condition. For instance, a person might struggle with sleep due to chronic pain or anxiety, making insomnia a comorbid condition. These different types of insomnia, primary and secondary, help professionals better understand and treat the sleep disorder. They also highlight the importance of considering all aspects of a person's health when addressing sleep problems. Whether primary or secondary, insomnia can have detrimental effects on our daily functioning. What causes insomnia? It's not as straightforward as you might think. Insomnia can stem from a variety of sources, with psychological factors often playing a significant role. Stress, anxiety, and depression, for instance, can lead to sleepless nights. Medical conditions, too, can be a culprit. Conditions such as asthma, chronic pain, and neurological disorders often come with the unwelcome side effect of insomnia. Lifestyle habits also weigh in. Those who work late hours, consume caffeine or alcohol close to bedtime, or maintain irregular sleep schedules might find themselves tossing and turning. Medications can also contribute to insomnia. Certain drugs used for conditions like depression, high blood pressure, or allergies may interfere with sleep. Even a simple disruption to our internal body clock or circadian rhythm can lead to insomnia. This rhythm, which regulates our sleep-wake cycle, can be thrown off balance by factors like jet lag or shift work, making it hard for us to fall asleep or stay asleep. As you can see, the causes of insomnia are multifaceted, making it a complex issue to address. Now that we know what causes insomnia, let's explore the science behind it. The brain's neurobiological and neurochemical mechanisms play an essential role in sleep regulation. Insomnia can be linked to disruptions in these intricate systems. To understand this better, let's talk about the arousal system and the sleep-wake cycle. The arousal system keeps us awake and alert during the day. It's like an internal alarm clock that goes off when it's time to wake up and stay awake. On the other hand, the sleep-wake cycle, controlled by our circadian rhythms, tells us when it's time to sleep. But what happens when these systems start to falter? Well, disruptions in the circadian rhythms can lead to an imbalance in the sleep-wake cycle, causing us to stay awake when we should be sleeping and sleep when we should be awake. This imbalance can lead to insomnia. The neurobiology of insomnia is intricate, which is why it's crucial to conduct a comprehensive clinical assessment. How do we determine if someone has insomnia? The answer lies in a comprehensive clinical assessment. This process delves into several aspects of a person's life to get a clear picture of their sleep health. An assessment begins with a thorough medical history. This includes understanding any underlying medical or psychiatric conditions and the medications they are taking, as these can often influence sleep patterns. The next step is to examine the individual's sleep patterns. This involves determining how long it takes for them to fall asleep, how often they wake up during the night, and how refreshed they feel upon waking. Lifestyle and habits also play a crucial role in sleep health. Therefore, we explore aspects such as diet, exercise, caffeine and alcohol consumption, and exposure to electronic devices. Understanding these elements can provide insights into potential disruptions to the sleep-wake cycle. Finally, we consider the impact of insomnia on the person's daily life. This includes their energy levels, mood, work performance, and overall quality of life. With a comprehensive assessment, we can tailor the most effective intervention for each individual. Once we've assessed the situation, how can we help someone manage their insomnia? There are several approaches to this, and they fall under two broad categories: non-pharmacological interventions and pharmacological interventions. Let's start with the non-pharmacological interventions. One of the most effective methods here is cognitive behavioral therapy for insomnia, also known as CBTI. This therapy is designed to help individuals change the thoughts and behaviors that can interfere with sleep. It may involve different strategies such as stimulus control, which associates the bed and bedroom with sleep and sex only, and sleep restriction, a method that limits the time spent in bed to the actual time asleep, thereby improving sleep efficiency. Moving on to pharmacological interventions, these involve the use of medications. It's vital to note that while medications can be highly effective, they should be used judiciously. This is because some sleep medications can have side effects and even lead to dependency over time. It's also important to remember that not all sleep problems are best treated with medication. For example, medications may not be the best first-line treatment for long-term insomnia. Instead, they are often used as a short-term solution while other non-pharmacological interventions are being implemented. When it comes to choosing a medication, a healthcare provider will consider several factors, such as the patient's overall health, the nature of the insomnia, and the potential side effects of the medication. Some of the most commonly used classes of drugs for insomnia include benzodiazepines, non-benzodiazepine hypnotics, and melatonin receptor agonists. In conclusion, managing insomnia involves a combination of strategies. Non-pharmacological interventions, particularly CBTI, can be incredibly effective, and medications can also play a role when used judiciously. Remember, the key to managing insomnia lies in understanding its causes, assessing the individual situation, and tailoring the right intervention.